Parliament, the Stroke Association of Sierra Leone is concerned about an expired health drug, the vital amlodipine anti-hypertension tablet that's currently in circulation in the country. The association is calling on the Pharmacy Board and other agencies to mount a robust inspection and investigation of health drugs, importation companies and pharmacies to seize and destroy expired health drugs and prosecute the culprit, among other things. So to discuss this morning and other issues, we have Unisa Sise, who's a media coordinator, Stroke Association of Sierra Leone, and we have Dr. Sir Emmanuel Bomo, Head of Information and Communications, Pharmacy Board of Sierra Leone. Gentlemen, good morning and thank you very much for joining us.
Good morning.
Good morning.
This concern, Pharmacy Board is aware. When did you pick this up and what has been the action taken?
Okay, so the initial complaint came through our Drug Safety Monitoring Department, the Pharmacovigilance and Clinical Trials. There's a product in circulation that has some quality issues that we need to investigate. So immediately we had that one. Top management was summoned to an emergency meeting to take a look at the issue. We need to establish the fact what the issues are. So we found out that this is a particular set of products. It's not only one, a number of them, 3 or 4 or 5 of them, from one particular manufacturer, Leone Pharmaceutical PVT Limited, that is based in India, Gujarat. We found out that further investigations, when we went around to collect our own samples to check, find out that the moment you pick up this, you take out the tablet from the blister pack, it will immediately break down. If you squeeze it a bit, you put pressure on it, it will break down. Then we know it was then we came out with the conclusion that it was a quality defect. So we need to do further investigations. So currently we've mounted a recall. We've contacted all the local agents that are importing this product in the country. I'm giving them further instruction that we don't want all this product recall. Our teams in the regions as well as in Freetown, our inspector division was sent around to check all the pharmaceutical outlets, the pharmacies and drugstores, potentially where we can have this product, have them recall. We've withdrawn most of them. We've withdrawn virtually everything on the market. We've stored them at our office, but we are not going to stop at this point. We need to further inform the general public. So we issued a press release on the 12th of June, informing 2 sets of press releases, one for the general public and one for healthcare provider, the medical practitioners, that we have an issue with this particular set of products from one manufacturer, Leone, that people should not use this product. If you have this product for the consumers, you have to return them to the pharmaceutical outlet where you purchase them, or pharmacy board offices across the country. Also, for the healthcare providers, we told them that they should not prescribe this product for any other patient, and they should review their treatment plan for people that need this product, people that are hypertensive. And also, if there are further reactions that people are suffering as a result of this particular, they should report to the Pharmacy Board of Australia. So we did issue the product, and the recall is ongoing. We've mounted an investigation. We've already informed the local agents as to the next steps. There's going to be investigations both in Sierra Leone and both at the manufacturing plant.
Now, what's the situation you've picked up from the investigation? Is it that the drug is authentic but expired, or is it fake?
It's not fake. It's not expired. We have products that are within the normal shelf life batch that are within this particular product. They have the normal shelf life that are not expired, but there is a problem with the quality presentation. As I tell you, the moment you take the product of the blister pack, you put pound pressure, it will disintegrate or squash. So the issue here, there is going to be safety issue, there are going to be compliance issue, there are going to be efficacy. In other words, if you are saying you are going to take 100 milligram of amlodipine, you cannot take 100 milligram of amlodipine administered directly into the system if the product is going to break down before you ingest it. So what will, in effect, is going to happen is underdosing of the patient, which will create more problems in terms of the clinical symptoms and will prevent worsening the situation as they take the product. So this is why we alerted the general public, and we immediately went into action. We called all the products from the market. We are still cross-checking in our regional offices as well in Freetown, and we've called all the importers, the local agents, to discuss the issue, and we are mounting an investigation and we'll report back to the general public.
Is this a new brand in Sierra Leone, or has it been coming to Sierra Leone?
I'm hoping there are a number of brands. This one is a new company that have recently sent in the application which we reviewed. The issue here is that there is, from our own internal investigation, there are a number of causes that can...
Yeah, that's exactly why I'm asking you, to begin to figure out, like, how did this really happen?
So this is a regulatory agency.
Considering all the checks we've put in place to get products into the country, particularly medication, how did this happen?
Okay, so fine. This is an investigation we are mounting. We are a regulatory agency. We don't run into conclusion. There's a number of possible scenarios there. One, there might be a manufacturing error at the site where the product has been manufactured. Also, there's a possibility, there's temperature and humidity fluctuation at the storage sites. The product can come in the country with all the necessary checks, in good state, but if also the storage conditions under which the product has been stored is also an issue, then we have a situation like this arising. So we are doing our investigations, and the necessary regulatory steps are currently be taken. We inform the general public as to the outcome there. So there's a possibility of a manufacturing error from the manufacturer. There's also a possibility of storage conditions at the site. There's also a possibility of storage condition even after the patient has procured the product and taken them to their house. So these are a number of the things we are looking at currently.
Dr. Bomo, help us understand the procedures of allowing these drugs to enter Sierra Leone.
Okay, fine. So there's a number of issues here. First and foremost, you have to be a registered importer. You have to be issued with an import license from the pharmacy board. You have to be an importer. So when you've gone through the aspect of the import license, you have to apply to the pharmacy board for an import license, and you have to have a pharmacy professional who is a technical head attached to your outfit that is going to apply on your behalf to the pharmacy board of Sierra Leone. You face a panel that is going to interview you, headed by the registrar with other top management staff and also the board members sitting on that panel. Then we ask for a number of documents. First and foremost, you have to have a police clearance. We don't issue a license to people with criminal records. We also have to have attestation from senior citizens in the country that you have good standing. Then we are a government agency, so supported our government agency carrying out their functions. So you have to do your tax clearance. So you have to be of good standing in terms of your taxes. Then you face a panel. If we are satisfied with what you do with your interview, they will grant you the license. Then you should have your warehouse where you store your product with all the necessary support equipment to store the product. That's the first phase. Then the site where you are manufacturing has to be visited by senior staff to confirm that the manufacturing process in terms is in line with the good manufacturing practice. So after that, then you apply for an import permit. This import permit is what we issue you take to your manufacturer to do your consignment that is coming to Freetown. When the consignment gets into Freetown, we have two official ports of entry: Lungi International Airport, Waterkey. Our staff are there alongside NRA staff. So we'll do the necessary check, we'll pick the samples. Then if everything is okay, they will allow you to take your product to your warehouse. So the rest of the distribution chain, the pharmacy, the drugstores, the retail outlets, we go and buy from your outlets, and they will take it to their pharmacies for the storage. This is where the members of the general public will source the product based on the prescriptions from the medical practitioners or the prescribers.
I know you understand how serious the situation is, because we are talking of a medication that is already in the market. It has crossed through all of the processes that you've mentioned, and it's the only time that you're picking it up that indeed there is an issue of quality defects on this product. So,
as I said earlier, the product can come through all the necessary checks in a very good, can come through all the checks. There are no issues there. But there's also a possibility of the storage conditions, both at the site where the product has been stored, and also at the possibility of the product, the way the consumers have stored their product in their homes. So all of this can be a possibility. So as I said, we are doing a comprehensive investigation into this matter, and this is a regulatory agency. When issues of like this come up, the moment we have the information, we start our investigation. We inform the general public if there are issues, because we know this is a special group of people. These are people that are hypertensive, that need this specialist drug. But the good news here we have that this is not the only product or only brand of those products on the market. That's why we issue instructions to all other people that you adjust the treatment plan. There are other brands available on the market which you can use. For in the interim,
from your submissions, you said you've already contacted the manufacturer.
Yes, through the local agents, we've done that.
And so what's the response of the manufacturer? Because it's very serious. This product will have landed in
No, the issue is that the product have already been recalled from the market.
Are you sure it has been recalled?
We've recalled. If you go to our office, if you can send teams, you can go and confirm. We have the product already stored in our office and also in our website. We've done the necessary recall. So what we are now doing is that to do the necessary investigation so that in the future we don't have issues this repeating itself.
Eunice, once again, welcome to the program.
Thank you very much.
I sense the worried all over your face.